My name is Emese Kasznár, and I would like to show you the progress I made in the past 15 months with my PhD, which title is Physical Activity in Inflammatory Bowel Disease. I'm a PhD student and a pediatric resident at National Pediatric Institute, and my vision is to improve the management and quality of life of IBD patients, and my mission is to encourage IBD patients to exercise to reduce their disease burden. I have 3 specific goals. All of them are investigating different aspects of physical activity in inflammatory bowel disease. So let's jump to the first one. It will compare the physical activity between inflammatory bowel disease patients and healthy controls. A little bit of background. IBD's prevalence in 2019 was 4.9 million worldwide. This is a relapsing-remitting disease, which means that patients, when they are treated right and they respond to the treatment well, most of the time they are in remission. But some data suggest that even in remission, they have reduced physical activity. Why is it a problem? Because we know that reduced physical activity can lead to many other chronic diseases, such as metabolic syndrome, osteoporosis, and sarcopenia. So we raise the question, do patients with inflammatory bowel disease exhibit lower levels of physical activity compared to healthy controls? We used the PECO framework with the exposure being inflammatory bowel disease. We compared them to healthy controls, and we had 2 primary outcomes, metabolic equivalent of task minutes and time spent in moderate to vigorous physical activity. Our hypothesis is that healthy people are physically more active than IBD patients, and the clinical implication would be to encourage physical activity in IBD patients to reduce the risk of osteoporosis, sarcopenia, and metabolic syndrome. Because of the shortness of the time, I would like to jump to the first result of ours. Here you can see the time spent in moderate to vigorous physical activity. As you can see, if the diamond on the left side, it means that physical activity is decreased in inflammatory bowel disease patients. As you can see, it was measured in minutes per day, so it means that IBD patients spent less time in moderate to vigorous physical activity, less than 15 minutes compared to healthy controls. We could include 5 studies with more than 200 IBD patients and 100 healthy controls. As you can see, this result was mathematically significant and clinically relevant. So let's jump to the next one. It was daily steps. As you can see, we could make a subgroup analysis on adults and children as well. And we could include more than 100 IBD patients and more than 100 healthy controls. And as you can see, IBD patients had less daily steps, around 1,500 compared to healthy controls. This was mathematically significant and clinically relevant as well. Our next outcome is hand grip strength. As you can see, we could make a subgroup analysis here as well. And in the adult subgroup, it was statistically significantly decreased in the IBD group. So overall, we can say that IBD patients have decreased muscle strength compared to healthy controls. Our last outcome here that I want to show you is metabolic equivalent of task minutes. As you can see, we could include 5 studies with around 200 IBD patients and 200 healthy controls. But here we could not show any difference between the 2 groups. The reason for this could be that they measured these outcomes with subjective measurements as questionnaires, and they are not as reliable as other measurements, such as little accelerometers, which measures the daily steps and the physical activity more accurately. So the strength of our study is that we could analyze some outcomes in different age groups, but limitation that we could not analyze every outcome based on age groups. And the strength is that we analyze many objective parameters. The conclusion is that patients with IBD have lower levels of physical activity and muscle strength compared to healthy controls. So the implication for practice would be to advise patients to engage in more physical activities, and the multidisciplinary team should include a physiotherapist as well. Implication for research is to analyze patients with severe and mild disease activity separately, to analyze patients based on their disease duration, and analyze patients separately based on their disease type as well. Here you can see the progress of my first project. Right now I'm 50% done with my manuscript writing. So let's jump to the second project, which is investigating the disease, activity, and quality of life before and after exercise intervention in inflammatory bowel disease. As I had showed you before, IBD patients have decreased physical activity, but they also have decreased bone mineral density and muscle mass. In 2022, there was a meta-analysis made in adult IBD population, and it showed that physical activity can improve the overall health of IBD patients. It can reduce their anxiety, it can help with osteoporosis. So we raised the question, does exercise intervention affect disease activity and quality of life in IBD patients? We included children and adult IBD patients, and the intervention was structured physical exercise. We compared the change in disease activity and quality of life to the baseline measurement. The clinical implication is the same, to encourage IBD patients to exercise more to improve their quality of life. So here you can see our first plot, the change in health-related quality of life. We could include 9 studies with over 169 IBD patients. And as you can see, we had to use SMD because they use different type of questionnaires here. The SMD was 0.55, which is a moderate effect size, but on the patient's level, it means that their quality of life improved significantly because they did not have to go to the bathroom 5 times a day, but only 1. So because it is not statistically significant, we still think that it is clinically relevant. Here you can see the change in Crohn's disease activity index. And as you can see, we could include more than 200 Crohn's disease patients, but the diamond reaches the 0 effect line, so it was not statistically significant. As you can see, we included on the plot the disease activities, and as you can see, half of the studies only included patients who were already in remission, so we could not expect a big change here. Here you can see the change in ulcerative colitis disease activity. Although it seems that it does not reach the 0 effect line, it does. So it was statistically not significant here also. But as you can see, the same problem arises here, that most of the studies included patients who were already in remission. Here you can see the impact of physical exercise on hand grip strength. We could include 5 studies with around 70 IBD patients, and their hand grip strength improved, although it was just a moderate effect size. So the strength of our study is that the changes were compared to the baseline measurements in order to demonstrate the benefits of the physical exercise on the individual patient level. And patients with IBD were analyzed separately according to disease activity where it was possible. And we did a comprehensive analysis on subjective and objective parameters as well. The limitations that the heterogeneity of the interventions arise in terms of length, type, and supervision as well. It was not possible to analyze data by age groups separately in many cases, and the outcomes were reported in a variety of units of measurement. So the conclusion of our study is that regular physical activity improves quality of life, and there is also a tendency for disease activity scores to decrease, even in patients who are already in remission. The implication for practice would be the same as I mentioned before, and the implication for research is to include patients with active disease in these studies as well, and further research is needed to identify the correct and the most effective physical exercise form. We found that including children would be important because 25% of the IBD population are diagnosed in childhood. And researchers should describe the precise way of the interventions. The current status of my project is that we submitted it to many journals. Currently, it's under the Journal of Cachexia and Sarcopenia and Muscle. So overall, I have 3 projects which are investigating different aspects of physical activity in inflammatory bowel disease. And hopefully with these, I can encourage IBD patients to exercise more to reduce the disease burden. I would like to close with Carl Sagan's word, somewhere something incredible is waiting to be known. Thank you for your attention.
Thank you. So congratulations on this beautiful and meaningful work. I wanted to ask you if you could summarize for us what do you think is behind this reduced hand grip strength in this patient population, and if there are any disease-specific factors influencing grip strength?
Thank you for your question. So in adult IBD population, we know that many patients suffer from sarcopenia, which means they have decreased muscle strength and muscle mass as well. And this means that they respond to treatment less effectively, and it can lead to many other complications in the disease. With the children, we do not have as many data. And we suspect that the chronic inflammation in the body and the inactiveness of the patients lead to the decrease of the muscle mass and strength as well.
The question would be, do you know any data on BMI and effect of exercise in this pediatric population with IBD? I would suppose that those with low BMI and with high BMI would move less, and it would be interesting to compare those only with normal BMI, because obesity also in the IBD population is a huge problem, especially what we see in adults. And of course, those who are active have lower BMI. So do you anything about that?
Thank you for your question. Sadly, in the pediatric population, there are limited data available. We were searching for not just BMI, but also skeletal muscle mass and bone mineral density, but most of the studies did not report these or didn't even measure these outcomes.
Thank you for your presentation. Emese, I have one question. In your third figure in the second project, the ulcerative colitis disease activity, there is only one study on the other side of the plot, the Kaur et al. 2021. Any explanation for this study? Because I think it might be affecting your statistical significance at the end.
Yes, there was a patient who relapsed during the exercise intervention. They did not think it was because of the exercise intervention, so they did not want to exclude her from the study, and that's the reason for the outlier.